Hello, it's Rachel here. I'm just waiting a little bit for everybody to show up. It's a pleasure to meet everybody. My name is Rachel. I'm a maternity nurse. I'm also a lactation counselor. I'm so excited to be able to see everyone. This is going to be my childbirth class. I'm very excited to see you all. I'm just going to give everybody a little bit of time. But if you wanted, you also can, in the little chat box, you can say where you're from, maybe a little bit about yourself, how many weeks you are. I'm very excited to get to know everybody. This is going to be a great class. It's about 2 hours. We're going to go over childbirth. We're going to go over breastfeeding, baby care, go over whatever questions that you might have. I'm very excited to answer them. I also work in the hospital too, so at least I can go over whatever questions that you guys might have in the process. Do I have anybody that is going to be delivering pretty soon? I know that we probably have people from a few different places around here. For those of you just coming in, my name is Rachel. Sorry, just got a little blurry there for a second. My name is Rachel. I am from Florida. I have 2 kids myself. So you guys can use the chat box if you want. You can say where you're from and then how many weeks you are. So I'm Rachel from Florida. I have 2 kids, so not pregnant right now. Been there, but it's such an exciting time. So for those of you who have not seen on the online course page, there is a place where you can download the PowerPoint. So that is the PowerPoint that I'm going to be using for this class. Just gonna head over there so you guys can see it. We'll start. And then if you have not seen the PowerPoint yet, it is on the online course page. You can also email me at mommydidyouKnow@gmail.com, and I'll be more than happy to send it to you guys as well. So I have Chelsea outside of North Carolina, 17 weeks tomorrow. That's so exciting. I'm so happy to be able to have you on this class, Chelsea. We also have Samantha, who's a first-time mom. We have a lot of first-time moms who join us for this class, so you're definitely not the only one. And then we have Adrita, whose due date is July 21st. That's exciting. That's actually close to my birthday. My birthday is July 17. Wow, first-time mom, also 19 weeks. Nicole from Chicago, she's 17 weeks. So I have usually a lot of first-time moms in this class, especially because there's so much that is unknown, of course. There's a lot of things that I'm sure you guys have a lot of questions to ask. You guys also have completely different experiences, different walks of life, different counties, different cities. So it's great to be able to see everybody, bring us all together for this wonderful class. In case you have not seen on mommydidyouKnow.com, I have a lot of great classes for you guys. I'm not sure if you guys have tried my, the free class is basically a lot of videos. I also have great research-based articles. I found that sometimes it's hard as a new mom to find good research-based information. So if you haven't seen, I have a lot of stuff about childbirth, about breastfeeding, pumping, a little of everything. And then we also have Bree, which is from Landrum, South Carolina. So we have 2 South Carolinas, 25 weeks and due July 22nd. So yet again, close to my birthday, which is great. So this is 8 steps to prepared childbirth. This is a class that I developed, especially because of my story. This, by the way, is me and my baby Nathan. So he is my second born. I have 2. I have a 5-year-old who's like 5 going on 50 because he's so funny like that. But when they're 5, they talk about some really funny stuff. But Mateo, and then my youngest one's Nathaniel, but we call him Nathan. So this right here is Nathan and me. So with my first delivery as a first-time mom, I had a lot of questions. I didn't really know that much. At that point, I had been a maternity nurse, but I didn't really know that much about the actual experience, because as much as we would like to say that reading a few books and taking classes makes you experienced and ready and prepared to be a mom, fact is A lot of the time, you don't really know everything until you're actually there. You have the baby in your arms, and then you start to go down that track to start, realizing what to do. And then hi, everybody who's coming up, like Christina, Rob. We have a bunch of people about 29, 30 weeks. It's fantastic. So as you guys know, as much as you would love to be able to sign up for a class and know everything there is to know, of course, you're not going to be able to prepare yourself for everything that will possibly happen, and that's okay. So for me, with my first, I thought I came into this knowing a lot, but my labor was awful. I had like 18 hours of labor. Breastfeeding was very difficult for me too with my first. I was a maternity nurse, but then when the baby came, it's just I noticed the latch was really painful. I was getting like bleeding and really bad jaundice issues. He was on phototherapy for a week. I just felt like everything that I can do as a mom, I was just kind of failing at it, dealt with a little bit of depression. Then when I had my second baby and everything changed, I had my second baby, I'm like, all right, these were the barriers that I faced. I faced barriers such as not knowing how to manage my pain during delivery. I faced barriers such as phototherapy and how to make sure the baby was latching on correctly. And then what I did was I started researching how to overcome barriers. I find that a lot of people, they might get the basic of, this is labor science and this is this and that is that, but they don't really go over how to overcome barriers. And as much as we would love to say that babies have a manual and they follow it to the T, they usually don't. So what I do is this 8 steps of prepared childbirth goes over the barriers that I faced and barriers that other people faced. And they go over how to overcome them, because I want to be able to equip you guys to be able to overcome whatever barriers that you might face to your specific goals. So let's say your goal is a natural childbirth. I'm like, all right, let's equip you for your goals. Let's say your goal is to have an epidural. Let's equip you so you know what to expect and overcome any barriers that you might face for that. So we have a few more people also. So I'm so excited to be able to see so many people today. And I hope that I will be able to kind of just help with the stress a little bit and help you to understand what to expect. So our first step, so these are 8 steps to kind of prepare yourself and to help you to overcome the barriers to reach your goals. Number 1 is understand your body. Everybody goes through different symptoms as they're pregnant. For me, with my first baby, I dealt with a lot of morning sickness. What really helped me was I actually had to even suck on a lemon. I remember being on night shift at the time, dealing with a lot of nausea, and I would like suck on a lemon in order to get the nausea away. So I'm not sure if anybody is dealing with anything specifically. You can mention in the live chat, or if you have something that even if someone says, oh yeah, I'm dealing with morning sickness, if you have like, oh yeah, I lowered my grease content and that helped me with morning sickness, that would be great too. So for morning sickness, what really helped me was I found what times of the day that I was least nauseous, and I tried to eat around those times. I tried to have the lemons. Like I said, I would kind of need a stash of them. I tried to drink some water as much as I could to stay hydrated, especially because sometimes if you're nauseous and you can't eat that much, it sometimes can, be a little irritating for you if like, you're like, I can't eat anything, I can't drink anything. But sometimes if you can eat smaller meals, that usually can help you as well. I also dealt with a lot of sciatica. Sciatica is like especially with my second baby, I noticed that I had it a lot with my second. It's kind of like the sharp pain that goes from the foot even all the way up, and especially in your hip area. I noticed I would get it a lot when I was even doing fundal checks for my moms in maternity. So I worked mostly postpartum. And I remember trying to bend down to do fundal checks, to do the uterine checks to make sure that everything was okay. And then all of a sudden I would get the sharp, like all the way up. So that's sciatica. What helped me with that were compression stockings, were also abdominal support bands for the back as well. I know some people deal with heartburn. You can try lessening the amount of greasy foods. You can try to, Chelsea has the hip pain as well. So especially with me, I have awful. Like with my second delivery, it was so bad. I wasn't able to work in the hospital unless I had a support band. So you can try those support bands. You can try the stockings. The stockings really, really helped me. And then if it gets very bad, you can also try some warm compresses and washcloths around the hips, and that can help as well. You can have insomnia. Insomnia can be awful while you're pregnant. So if you're having insomnia, you can try to limit the amount of like, I'm trying to think of the words here, but you can limit the words of like iPads, you can limit your use of phones, digital, all of the screen time, limit the screen time before you go to sleep. Sometimes that can help. For me, sometimes I even had to make a list of things that I needed to do just to like take 2 minutes. I had to make a list because that I noticed that when I was pregnant, especially getting towards the end, I couldn't sleep because I was thinking of all the stuff that I had to do. So what helped was I'm like, all right, I'm going to make a list, just 5 things. Okay. Boom, 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 boom. That's it. Close my list, go to sleep. So for that helped me too. Nasal congestion. Unfortunately, you can't really use those Afrin nasal sprays, but you can use the neti pots with the saline. You can use the normal saline. And unfortunately, sometimes congestion does happen, especially in your second trimester going into your third. Now, those were some normal pregnancy issues that some people deal with, especially that I dealt with. But I want to go over complications too, because I think that a lot of people don't really realize the complications that can occur during pregnancy and what to do about it. So first off, can anybody tell me what is preeclampsia? So don't worry, I'm not going to bite your head off if you have the wrong answer, but can anybody tell me what is preeclampsia, or even what is it? What are some symptoms of preeclampsia? If you might not know the medical definition of preeclampsia, that's okay. But maybe you know some symptoms of preeclampsia. And this is something that a lot of pregnant moms don't really know about. Some of them do, but we will see. But who can tell me what is preeclampsia? And by the way, we are on the computer, so you can always have another tab and Google what is preeclampsia. And that can help you to answer the question as well. But preeclampsia is high blood pressure during pregnancy. So you were very close. Preeclampsia, when you have high blood pressure, and you were close, Rob, especially, I don't know if that's daddy's name or mommy's name, you never know. Weight gain can be a risk factor for preeclampsia, such as, let's say, people that are a little bit more obese or they have a higher BMI, sometimes might be at a higher risk for having high blood pressure and high blood sugar, which is gestational diabetes. So you were very, very close. And then I love how you guys are mentioning the symptoms. So you guys are correct. Symptoms such as protein in the urine, we have swelling of the hands and feet, headaches, and then if the blood pressure were to get too high, it can even cause seizures. So blood pressure during pregnancy, it has a few different complications, some for mom, some for baby. For baby, one big thing you're thinking of is what is happening as that blood pressure is increasing. It's constricting your blood vessels. So if you are trying to deliver nutrients to your baby with blood vessels that are constricted like this, obviously the nutrients that are heading towards the baby will not be as much as they should be, meaning you're going to have some placental insufficiency or deficiency of oxygen, just because as those vessels are constricting, it is decreasing the blood flow to the baby. So as that happens, yeah, I figured it would be daddy's name, and I'm like, hey, you never know. Let me see. So as you have preeclampsia, one huge risk factor for the baby is that there's decreased oxygenation to the baby. And also sometimes even the baby can be, if you ever heard of IUGR, intrauterine growth restriction, or you can even have SGA, which is small for gestational age. Those are all complications of preeclampsia. For mom, however, obviously you have the ones that you guys mentioned, you have the swelling, you have the protein in the urine, but we also have the seizures. That's a huge one. Another one that some people don't realize is as preeclampsia causes that increased stress on the uterus, it can even cause premature ejection of the placenta, which is a placental abruption. So when that happens, that is a medical emergency as well. So I don't know if anybody does have preeclampsia or they have high blood pressure, but those will all be things that you will be looking for. Usually preeclampsia, so your normal blood pressure levels, you'll have a high number, is the one on the top, because you'll have a top number and you have a bottom number. The top number for blood pressure, whether you're pregnant or not, this is just, you know, for kicks, especially I'm a nurse, so I love to teach. The top number is the systolic. That is the pressure on the heart as it is contracting. The bottom number is the diastolic. That's the pressure in the heart as it is relaxed. So your normal, we normally say like 120/80, but sometimes it can be even a little higher as you're pregnant because you have those increased fluids. So let's say for me, I'm normally like 100/60, like my blood pressure is really low. But when I'm pregnant, sometimes it increases just because of the increased demands from your fluid. So as you have those extra hormones, extra fluids, sometimes your blood pressure can get higher. Now, if that high number gets like 140s, we're thinking, all right, we might want to put you on some medication. Usually it's by mouth. The bottom number starts to get in the 90s. We're like, all right, you know, let's take a look into it. Let's see what's going on. If it's 160, the top number, that's when they start doing IV medications and they start even protocols to get that blood pressure down as soon as we can. Another complication is gestational diabetes. That, I mean, most people know about gestational diabetes, but that's high blood sugar while you are pregnant. Usually it goes away on its own, same as preeclampsia, but you do want to keep an eye on it. Now, when you are pregnant, you have gestational diabetes, they'll check it normally by the glucose tolerance test, which they will be doing closer to your delivery as well. It's, that's when you have the super, super sugary drink. You'll have to fast for that one. So they'll fast, they'll take your sugar, you'll have a super sugary drink, and then they'll check your blood sugar after. If it is abnormal, they'll normally have you try it again. They'll see if you're the same or, you know, a little different. If you are diagnosed with gestational diabetes, you can be diet controlled. If it's not diet controlled, sometimes they might have some medications for you. But usually diet controlled, as a nurse, that's usually what I'll see. But if you do end up on insulin, what's really important to note is that the baby, when the baby is born, if you're on insulin, especially I work mostly postpartum and nursery. So I deal with moms and babies after they deliver, but sometimes I do transition, which is when, you know, the baby's right after birth. I deal with the baby to transition and catch the baby and, you know, all that good stuff. Sometimes I do NICU as well, sometimes peds. So I have a little bit of everything I bring to the table. So the big thing that I'll notice with my babies that have moms that are gestational diabetic, sometimes they'll come out and they're used to this high glucose, just, you know, always coming in. They're used to this high transfer of glucose. And what all of a sudden happens is because mom is no longer supplying all of this glucose, the baby's sugar sometimes goes really, really low. So if you are gestational diabetic, especially on insulin, make sure that you are checking your baby's blood sugar, you're doing skin to skin, and you're trying to make sure that the baby is feeding well. Complications, also preterm labor. If you have preterm labor, usually signs of those would be bleeding. You would have cramps that are regular in intensity. Sometimes you might even have your water break. Just because your water breaks does not necessarily mean you're going to deliver right then and there. But if your water breaks, it is good, especially if you're premature, go to the hospital, because I have seen that, you know, sometimes we can keep the baby in there for quite some time if they take the necessary precautions. But also if you have preterm labor, they'll normally want to give the baby some medications to help to stimulate lung growth and different things like that. So if you start showing that you're in preterm labor, definitely head to the hospital, let your doctor know so that they can take the necessary precautions to make sure that the baby's covered if the baby does come early. Abnormal lab work as well, ultrasounds. So if you have any questions, by the way, you can always email me. I do have prenatal and newborn consultations that I do. If you look on the description on this page, you'll see a whole bunch of different links. I have childbirth, prep course. In addition to the free one, I also have a regular childbirth prep course, which is fantastic. That is a 2-week course that goes more in depth about all of this. As much as you would think that, how much more in depth can I get? Trust me, I can get much more in depth. I also have a lot of great resources for you. So case study. So in the end of every step, what we're going to do is I'm going to come up with some sort of problem or issue that a mom is having, whether it be me or another mom. And I want you guys to give advice on how you would overcome that scenario. So for example, this first scenario is me, and I am really bombarded by hyperemesis. That's when I'm very nauseous and not able to eat. So if you had a friend who is me, who is dealing with hyperemesis, or maybe you are, what are some recommendations that you would give me? What's some advice that you would give me? And yet again, this is me and Nathan, because I just think he's really cute. But what advice would you give to me or anybody, to you, to your friends who's dealing with hyperemesis? And I'm definitely going to talk about hyperemesis because with hyperemesis comes a lack of nutrition. Lack of nutrition means lack of nutrition for a baby. And you want to be able to have a healthy weight gain as you're pregnant. So you want to have a healthy nutrition as you are pregnant. Make sure the baby gets all of the good stuff that they're supposed to have. And then keep up with your prenatal vitamins as well. You can even have prenatal vitamins after delivery, by the way. That's for, especially if you're breastfeeding, when you continue your prenatal vitamins, it really helps because it can travel to the breast milk for baby. But some ways that I would tell my friends or whoever it was to overcome hyperemesis, I would say to try to eat smaller meals frequently during the day. I would try to say to drink as much fluids as they can. I love how Chelsea mentions B6 and Unisom. So I did not mention that because I wanted to see if you guys actually knew about it, but it's great. B6 is such a wonderful, wonderful help. Usually people who are dealing with nausea that take B6 usually say that they're better within 12 hours. Now, I wish I knew that when I had my first baby, but yes, so Chelsea is perfect. As long as you have your doctor's permission, there are some medications, you can always get prescriptions. And then Nicole, talk to your doctor, join an online mom group to see what other pregnant women have done to help. And I love how Nicole's talking about the support groups, because if you can be in another group with other moms and talk about similar issues, it makes a huge difference. And then Bree said, drink green tea with ginger, honey, and lemon, or get ginger chews. That's such a great idea. What helps me too, so I don't know if anyone has tried this, but I do this for my patients sometimes, is I'll have ginger ale. I'll put ginger ale in the microwave for like a minute, make it, a little warmer on the warm side. And then I'll put a tea bag inside, and it's my own little ginger tea. But that's what I do for my patients. Sometimes if they can't pee, is I'll make them ginger tea. And then peanut app is a lifesaver. So that's really good. I've heard about that. So you guys can always try that out too. That's why I love having this interaction, that you guys can be able to help each other with this. Now, our step 2 is mental preparation. I know a lot of people, they look into the medical side of things and they kind of neglect the power of their positive thinking, the power of their words, and mentally preparing for, eating the lemon and salt, just like what I was doing. Exactly. So you guys are right on board. Perfect. You guys are fantastic. So for me, I did mention a little bit how my first baby, I had a little bit of an issue with postpartum depression. The biggest reason for that was the change of dynamics, I think, between with my first, we had my husband and I, we have, fun together. Then all of a sudden the dynamics change. All of a sudden I have a baby. I'm also a pastor's wife. And I noticed too, with my first baby, I was always really involved in church. And with my first baby, it was like, all of a sudden I couldn't be in the altar as much. I couldn't be as active as I wanted in my church because I had a baby attached to me. And, no matter what whatever gives you joy, whatever you're connected with, sometimes when the dynamics change of that and you don't feel as used as you used to be, or you don't feel that you're doing the same things that you used to, sometimes that's how you can get a little bit of anxiety, baby blues, postpartum depression. Now, what I did for that was I made sure that I had people that can support me. And I noticed that because I remember for me, for example, I'm somebody that I love to worship and I love to, be in the music and everything. So then I remember I was sitting there and I'm like, man, I really want to get to the altar, but I really can't because I have the baby. And then I remember my friend, she came up to me and she grabbed the baby for me. And then she was like, oh, I know you want to go up there. Why don't you go ahead and go up there? I'm like, and then it hit me like that. So whether it's a similar situation with church or whatever, maybe you're in a book club, let's say you're in a book club and you want to read the book, but, all of a sudden you can't be because you're attached to the baby. Find something that whatever gives you joy before, try to do similar things to that. If you love music, keep listening to music. Don't neglect what gives you joy. And I always tell my clients too, if you can have a little bit of time just for yourself, whether it be, a shower for 10 minutes or, once a week, go walk in the beach with, your partner or whatever, whatever it can be, you need to be able to have time for yourself and you need to prepare that. I think that was one thing that shocked me a little bit when I first had my first baby, was that I was not realizing that I have to prepare for things like that. So it's really important, the power of preparation, and then the power of your words too. Your words, remember, have such an impact of your life. You want to stay positive. If you have negative people that are impacting you, it really can make a big difference in your life if you have these negative voices in your life. So although you don't want to cut people off, but you can talk to them and be honest and say, hey, it really bothers me when you say this, it makes me feel, this way. And then just be honest with them, be open, and try to keep positive support system close and negative emotions kind of at bay. Don't neglect what gives you joy. Try to continue doing the things that give you joy and keep your support system close, as close as you can. Be open with your wishes regarding labor, delivery, childcare, but still accept them to help you. So that was one thing, was I was with my first, especially, I was kind of nervous of having other people watch the baby for me, even for small amounts of time, because I'm like, all right, I don't want them, if I'm breastfeeding, to give them formula, but you just be open with them. For example, I would tell my mom, hey, the baby needs to eat at this time, this is the milk for this bottle. If I, expressed the milk and I gave it to her, I'm just open about my wishes. And I'm like, if the baby gets hungry after this bottle, I have this in the fridge, but don't give formula, something like that, if that is your decision. But keep your support system close and just keep them aware of what your wishes are. And then I have Jocelyn. So this is another case study now, and she is overcome with fear of being a first-time mom. So what advice would you give for somebody who is overcome with fear of being a first-time mom? And I want to especially go over this because a lot of you guys are first-time moms, and I'm sure that it feels overwhelming. And I want to hear what you guys have done to overcome your fear of those family dynamics, those changes. What preparation have you guys made for, when the baby comes? What support systems have been good for you? How have you overcome the stress and anxiety of being a new mom? Now, what helps too is I'm sure we have some people in this that are watching this that are not first-time moms. So what maybe are some things that you wish you would have done when you were a first-time mom as well? And drink water too. It's very helpful to drink water. So for me, what really helped to overcome the fear of being a first-time mom was preparation. Listening to also my support system, what they were up to, what they were doing, what works for them. Whenever you're taking advice from somebody, and this is not just for pregnancy or childbirth, but this is just overall, but if you're taking advice from somebody, look at their life. So if you're taking advice about relationships, or you're taking advice about childbirth, or you're taking advice about parenting, look at, if you're taking parenting advice, how are they parenting their children? You know, if you're taking childbirth advice, what was their childbirth experience like? If you're taking relationship advice, what is their relationship like? Make sure that you're taking advice from the right people. So I like how Nicole says some fear is totally normal. Sometimes even validating your concerns makes a huge difference, and will help you prepare, talk to other parents about their experiences, and learn all you can. If the fear is debilitating, see a therapist. So that's great. You know, there's nothing wrong with seeing a therapist if you feel like that fear is starting to become debilitating for you. If you feel like it's overcoming you, get the help, get support that you need. So I love that. Thank you so much, Nicole, for that little tidbit. That was great. Now, step 3. So we've already talked about what to expect in your body. We talked about overcoming some barriers while you're pregnant and complications. We talked about step number 2, mental preparation and overcoming some stress and anxiety as you prepare to be a new mom. Now, step number 3 is know how the body progresses through childbirth. So this is really important to know some expectations and complications as you are going through childbirth. Especially sometimes moms might not know the medical terminology that we're saying, but at least you can kind of get a handle on what we're talking about. So as you are going through labor, we have a few normals that are to be expected. One is lightning. That's as the baby starts to make its way to the vaginal canal, starts making its way through the birth canal, and it engages in the pelvis. You might have some lightning. That almost feels like lightning coming from the pelvis all the way up. So that's to be expected. Bloody show, even your mucus plug. Sometimes that you'll see that even days sometimes before. You might even see your water breaking. If your water breaks, keep an eye on the color of it. Keep an eye on the smell of it as well. Bree says, take one day at a time, make to-do lists for every day. Especially I'm a big list person. So I love that. What you want to accomplish throughout the weeks, talk to others who have already experienced it. Lots of YouTube. And yeah, exactly. Lots of YouTube. And if you guys have not, subscribed yet, I have my YouTube channel is great. It has a lot of wonderful, wonderful information for you. One thing I do want to put on is more family focused stuff too, because I find that people are looking into like the childbirth stuff and they're looking into the labor stuff, but not a lot of the family dynamic stuff. So I was thinking of adding more stuff about family dynamics as you have a new baby. And I thought that would be really interesting too. So as your body progresses through childbirth, you'll have the lightning, you'll have the bloody show, you'll have the water breaking, like I mentioned. If you see any weird color in it, or you like smell anything strange in it, you definitely want to let your doctor know. If you see a color in it and it's not clear, make sure that you head straight to the hospital. Sometimes if your water breaks, you can usually stay home for a little bit longer. If it's clear, if you don't feel the contractions too strong, you can usually stay home. However, if there's a few reasons you would want to go to the hospital after your water breaks immediately. One is if it has a strange color, strange odor, then you'll want to go, because sometimes if the baby poops in the womb before delivery, that's called meconium. So it's a meconium stained fluid. That can be a sign of the baby going through distress. So in that case, if your water were to break and it had a color, go to the hospital. Number 2 is if you are GBS positive, which is group beta strep. That's a naturally occurring bacteria that a lot of women have in the vaginal area. But if they were to have group beta strep as they were pregnant and delivering, it can cause an infection for the baby. So if you are GBS positive and your water breaks, you want to go to the hospital so that you can have the antibiotics that you need before you have your baby. Or whatever other place you are going to deliver your baby, if you're going to a birthing center, whatever it might be, or if you're home and something like that happens, you would want to call whoever your medical professional is to come and see you. Sometimes if you are having a home birth, by the way, if you have water breaks with a color, sometimes they'll send you somewhere else just because you're a little bit more higher risk, but it depends on the expertise of your professional. Nesting, you know, I know everybody had some nesting. I especially had nesting. That's when you all of a sudden you have to start color coding your closets, and you have to start getting your nursery ready, and you have to start getting everything ready. That's nesting. You're getting ready for delivery. So then your body's like, all right, let's do this. You're getting ready for the baby. Regular contractions. So to be expected as you start heading through labor, the difference between real contractions and Braxton Hicks, or the practice contractions, regular contraction. So real contractions are regular in frequency. So they can be farther apart, but they're regular. They can be regular in frequency, and they're strong in intensity. So usually if you look at like the difference between your chin, your nose, and your forehead, usually a strong contraction you'll feel in your tummy, and it'll feel like your forehead. If you feel kind of like your nose or your chin, those are like mild and moderate contractions, where it might be like, all right, you might have a little contraction, but it won't be that very strong. Strong would be like your forehead. All right. So if you have something like that, that's regular and it's strong, you would say, all right, you know, something, we're heading towards it. Ring of fire, that's something that you don't want to have until you're ready to start pushing. So as you start pushing, well, as you get ready to push and you start to get to complete, you'll start to feel a lot of rectal pressure, almost like you need a poop. Then as the baby starts coming out, that ring of fire, it's when the baby is coming out, that's what you'll feel. So those will be expectations, just so you guys kind of know what to expect. Complications. Now, these are things that if you have these complications, that you kind of know what it is and what to expect if you were to have any of them. So abnormal heart rate, that's a complication, especially if, let's say, there's a cord around the neck, or you have some placental insufficiency, you're not getting the oxygen needs that you should coming to the placenta, you might have some abnormal heart rate. If that were to happen, they would put you on the side. They'll probably stop Pitocin. If you had Pitocin, they would try to give you oxygen as well to try to get that baby's oxygenation up. Even if your oxygen might be fine, but it's more for the baby as well. Lacerations. So normally you might tear a little bit, you know, after you have your baby, you know, that happens, but it can be up to even a 3rd or 4th degree laceration. So if it's just a little superficial one, maybe 1, 2, a little bit bigger, 3 and 4, that's when it starts hitting all the rectum and going all the way across. They'll have to do a big repair of that. But that's rare, on the rare side. Usually I'll see intact, maybe 1 degree, unless you have a complication of delivery, you have a big baby, you have a small pelvis, something like that. But usually you're all right. What they do to prevent that is they'll have like some oils, they'll try to do some little massages on there to try to prevent that. Also, episiotomies, by the way, it's kind of a, I know it's a touchy subject, but if you do have an episiotomy, there's some pros, there's some cons that I want you to know. Pro for episiotomy is that it heals quicker. And then that would be also if like you have a big baby, small mommy, sometimes they might want an episiotomy, or sometimes mommy might choose it for whatever reason as well. Of course, mom has a decision and everything. Know your rights as a patient. However, big con is that it hurts more than a laceration. So episiotomy, it heals quicker, however, it hurts more. So those are just things when you are making your decision to kind of make an educated choice. Failure to progress, if your baby does not come, just make sure to try to have your pain under control, pain managed. Sometimes that helps to progress you as well. Shoulder dystocia, that's when the head comes out but the shoulders stay. It's one of the biggest medical emergencies that we have. We try to get the baby out by having some pressure. If the biggest complication with a shoulder dystocia is sometimes the baby might have a cracked clavicle, which is the shoulder there. Sometimes if the baby's coming out, if the baby's stuck. So if they have that, they just have like a little sling that they put around. Umbilical cord issues, that's if there's either the cord is wrapped around the baby, or for whatever reason the oxygenation is not going in through there, that's a complication as well. And then malpresentation, of course, if the baby's feet first instead of head first, if they try to do a cervical exam and the baby, they feel the butt instead of the head, they'll be like, oh, okay, then of course, the indication would be for a cesarean birth, things like that. So we have case study now. I know that this is everyone's favorite part, is we have a mom who wants to know the difference between true and false labor. So what would you tell her? So let's say you, and I'm mentioning this of course too, because sometimes I'll get calls from people that like, even though like I'm primarily lactation and childbirth preparation, I'll get calls from people that think that they're in labor, and then they're asking me, should I go to the hospital? I'm like, all right, let's go through these different signs of labor so you can see. But tell me, how would you tell the difference between true and false labor? Now, there's more tips that I did not mention just because I want to see if some people will mention it now, but this is really important to tell the difference so that you can kind of know what to expect as you go through your labor process. So we did talk about the difference between Braxton Hicks, and we talked about the difference between Braxton Hicks and regular true contractions. Braxton Hicks are usually infrequent, that they're not very consistent in their nature. They normally, let's say you'll have one 15 minutes and you'll have one 5 minutes, 30 minutes. So they're not regular in frequency. They're also not that strong. So you can talk through them, you can breathe through them, you can walk through them. And then rather than regular intense contractions are usually associated with true labor. True labor, you'll also get the mucus plugs sometimes. You'll have your water breaking. You'll have your, you might even have your bloody show, things like that. True labor, another thing is that the difference between true labor and Braxton Hicks is Braxton Hicks usually goes away with resting and hydration, rather than true labor does not. Actually, if you are in true labor and you are resting and drinking water, it will actually progress your labor because that helps to relax you and move your labor along. Rather than Braxton Hicks, where if you had Braxton Hicks and you had false labor, if you just rest and you drink some fluids, it usually goes away on its own. So yes, Bree said false is irregular, do not get close together. True is get closer and closer together. So that's exactly true. So I'm so happy. I hope you guys are liking this class so far, and hopefully I'm bringing a different perspective to some of the topics that you guys have seen before. So step number 4, and you guys can have some water if you want, is understanding exams and treatments. And you guys can take a stretch too, because I love to teach. We have lots of great stuff in this class. So understanding your exams and treatments. And then after this section, we're going to go more into the labor section, and we'll have like a 5-minute break so that you guys can have water and go to the bathroom, because I know that you all are pregnant women who has a full bladder, I'm sure. So one thing that I've seen a lot of classes lack are prenatal exams and what treatments are required for different exams, whether it be maternal exams, newborn exams. So this is one thing that I go over specifically as well in my classes. So if you see on my resources where I have the childbirth prep course, I have more information on things like that. I also have the consultations, and then the where it says sign up for today's special by clicking here. That includes live with me Zoom sessions in addition to online classes, which goes over all of this, but way more in depth. So you can always sign up for those too. So I just went to the next slide. There we go. So maternal tests. So one is the CBC. So like I said, a lot of people, they don't really, I'll see this all the time. A patient, I'll come in, I'm like, oh yeah, I'm going to draw your blood. Okay, here we go. I'm like, all right, do you know what blood I'm drawing? No, you could just draw it. I'm like, no, you need to know what I'm drawing. So it's really important, even for your baby, always know what tests are they doing and what indications that will happen if the tests for whatever reason don't go according to plan. So we have CBC is the complete blood count. That is hemoglobin. That will also be your white blood count. Your hemoglobin's your iron level. So your iron is what carries the oxygen. So we want to make sure that you're not anemic If you are anemic, especially prenatally, if you are anemic before you deliver, sometimes they'll give you some iron. Sometimes they'll just watch you. Sometimes they'll give you IV iron, sometimes by mouth iron. If you're going for a cesarean birth, they might give you some blood before you go into the labor and before you go into the OR. So those are just different things to think about. Platelets are also what we're looking at on your CBC. That's your clotting factor. So if your platelets are very low, we're going to be making sure you don't have something called HELP syndrome, which is very frightening as well, because that's accompanied by some liver enzyme issues in addition to some blood pressure issues, which can be very detrimental for moms and babies. CBC, if your normal drop, now here's a little question. I don't know how many people know this or not, but it's actually really important to know. What is a normal drop in iron for a vaginal or cesarean delivery? You can say a vaginal is this, C-section would be this, or how many, I want to know if anybody knows what is a normal drop in your iron level. Now, this is very, 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 very important. The reason is because if I have a patient whose iron level is 11, right? And then all of a sudden we do her lab work and now she's 8. All right, that's a pretty big drop. You know, I'm thinking, all right, she dropped 3 points, you know, or even if she was a vaginal delivery and she dropped 3 points, I'm like, man, that's a pretty big drop, you know, 8. But if she before delivery was 9 and now she is 8, I'm like, all right, you know, she did not drop that much. But it's important to know what is too much of a drop for your iron. So usually when we start getting to the 3s and 4 points drop after delivery, that's when I'm like, all right, that was a pretty large drop. Let's make sure that she's not bleeding. Let's make sure that she's hydrated. If you are planning on breastfeeding, that's another thing, is sometimes if you lose too much blood during your delivery, sometimes you can have some issues with your milk supply. So if that were to happen, keep tabs on that, be aware, know your blood test, because then you can have some hydration, you can make sure the baby's eating well, drink plenty of fluids, get your iron levels back up. Rubella. So rubella, HIV, Hep B, those are all on the panel usually for your prenatal exams. If you're HIV positive, that's pretty much one of the only contraindications for breastfeeding. So HIV, you just won't be able to breastfeed. However, if you are HIV positive, that does not necessarily mean that the baby will have HIV, because the recent research has been fantastic for HIV, that babies now, as long as they have the treatment at birth, they have a very, very high likelihood of not contracting the virus. So that's actually a fun fact for those who don't know about that. But moms who have HIV, they're usually put on antivirals during their pregnancy. When the baby is born, they usually are able to have very good chances of not contracting the virus if they have early treatment. Hepatitis B, you can still breastfeed. The only thing with hepatitis B is that if you start getting bleeding or blisters, then you would not be able to breastfeed. But hepatitis B, you can still breastfeed, and then the baby will need, in addition to the hepatitis B vaccine, they'll also need hepatitis B immunoglobulin, which is another injection that they will give. The only thing is sometimes that's a little expensive, the hepatitis B immunoglobulin. So you might want to pay attention to that before, of how much that immunoglobulin will cost with your insurance. That way you can start kind of saving up for it, because it's very important. GBS, we talked a little bit about before. That is the group beta strep. If you're positive, you would want to make sure you have your antibiotics before you deliver. And you would also want to make sure that you keep an eye for infection after the baby's born. So infection will be such as a fever, or even sometimes low temperatures as well, lethargic babies, and babies that have respiratory distress also. So those are different signs. RPR is the syphilis screen. If your RPR is positive, they'll do an RPR on the baby and see exactly if it's an old syphilis virus, or if it's a new one. If it's a new one, then the baby will probably be admitted to the NICU for that. If it's an old one, and then you'll probably just be seen outpatient, and that's about it. Drug screening, it depends what drug that you're positive for, but I know that sometimes people have been having those like the THC gummies and the creams with the hemp oils and things like that. So if it's something small like that, normally you will still be called for DCF, but they won't necessarily accept the case unless it's one of the bigger ones. But of course, it depends, on each person, but that's just what to expect. They'll normally take if you are positive for whatever drug it might be. Sometimes if they do a drug screen after you had your cesarean delivery, you might be positive for opioids, but that's just because of you just had delivery, you just had surgery. So if you are positive for whatever reason, the baby will have a drug screen as well, and that's normally a bag that they place on the baby. PIH labs is if you have pregnancy-induced hypertension, gestational hypertension, the preeclampsia as well. They might do some lab work for that, just make sure that everything's okay. Those will include urine screenings in addition to complete metabolic panel, see how your liver enzymes are and all that good stuff. Vaginal exams they'll be doing when you're in the hospital. That will be it really depends how often they would do it, but normally after your water breaks, they don't do the vaginal exams that much, just because they don't want to have that increased infection risk. Now we have some newborn tests here. So normally babies, when they're born, they'll have 24 hours of life, they'll have an infant screen. So every state is different, but like ours in Florida, we have the metabolic panel, which goes over metabolic disorders, amino acid deficiencies, even thyroid disorders, cystic fibrosis, goes over a whole bunch of different things. Every state has different tests that they do for their babies. So it's normally around 24 hours after the baby's born. That is by a heel stick. One reason we might do an IV stick or like even a butterfly would be for a sepsis workup. So that's if we feel like the baby might have an infection. That will be a sepsis workup. Glucose screen is if the baby's, let's say mom had gestational diabetes, or the baby's low birth weight or is very big for their gestational age also, we might have glucose screens. And cord blood profiles, that's to see the baby's blood type. So those are all different newborn tests. So we're just going to do this case study and then we'll have a 5-minute break before the second half of this class. I hope that you guys are learning a lot. I know that I really enjoy teaching this. So I have mommy Marlene. Now she is GBS positive. I want you guys to tell me, or you can write it down, what are some advice that you have for Marlene that she is GBS positive. Now your advice can be when to go to the hospital. Your advice can be what to expect when she goes to the hospital. Your advice can be about if her GBS is positive, how to tell if her baby has it. So what would you tell Marlene about her baby who will be born, or what to expect as she is GBS positive? And one little note too is you can save your baby from a lot of tests and treatments, and this can save you a lot of money, is if you bring your prenatal records. So one thing as a nurse that I find too is that sometimes people don't bring their prenatal records. Then we have to treat them as if they had, let's say they had GPS, like even though you might be negative, but because we didn't have your prenatal record on file, we had to treat you as if you had it. So if you want to save yourself from unnecessary treatments and medications, or even like, let's say you delivered, got to the hospital, delivered really fast, and we didn't have your prenatal records, and you didn't have antibiotic treatment, your baby would have extra tests because they would be doing the sepsis workup when you might have been negative to begin with. So if you have your prenatal record, that really helps so that we can avoid all of that. Some doctors do have connections with the hospital that they'll send the hospital transcripts over, but it's better to have it yourself just because you never know. And Nicole was right. Expect to take IV antibiotics prior to delivery. Usually it's ampicillin, but it can be different, because Different people have allergies and policies as well, but it's usually one of the ampicillins. So ampicillin is usually the one that they'll use. Now I will give you guys 5 minutes breaks. It is 3:55. So I will give you guys, 5 minutes until 4 o'clock. So you guys can come, at least Eastern Standard Time. But so I will give you guys a 5-minute break. I know that we've talked about a lot of great stuff. We'll start heading towards the labor process itself, and then we'll spend the rest of the class on what to expect for your newborn and breastfeeding. So while we are taking this break, I will take questions. So if anybody has any questions about any of the material that we've done so far, be sure to let me know. You can also send me an email at mommydidyouknow@gmail.com. And yes, this YouTube video will be available to everyone. It's just sometimes if it's a live stream, the YouTube looks over the stream, I guess, to make sure that it's up to their policies and everything. So sometimes it takes a while for it to be live on the channel, but yeah, it definitely will be available again later. So I hope you guys are enjoying it, that you guys can watch it again anytime. And mommydidyouknow@gmail.com, you can ask me as well if you had any questions. And then you also can sign up on the on the link where it has all of the childbirth preparation courses and consultations. So keep my information, by the way. I just want to mention that to everybody who's taking this, because let's say you don't have the prenatal consultations with me. I do newborn consultations where we go over what to expect after the baby goes home, how to put the baby to sleep, breastfeeding. I do pump sizing. I do latch assistance as well. I'll help you if you're painful, when the baby latches on. I have specific tips that I do to help people. So keep my information, because sometimes I'll have people that take this class now, and then months down the road, they're like, oh yeah, I remember you, can we have a consultation together? So keep my information so that if, anything ever does happen after the baby's born and you guys have questions, I'll be more than happy to answer them. Or even, let's say I have a few people that are 17 weeks now, you might want to wait before having a prenatal education, because I do live classes as well privately. So you might want to wait a little bit before taking my private classes too. If you do, just save my information. So far, what's your favorite part of this course for those of you who are on here? How would you recommend we get our prenatal records? So Samantha wanted to know how we can get our prenatal records. You can request it from your OB's office. So normally your OB, they are very bad at giving you your records if you ask the OB directly. So I would ask the office instead. You can even, some OBs, you can even have the portal where you can have it on your phone. So if you can have that, that will be good as well. My OB, my last one was very, he's more tech savvy. So all of my records were on the patient portal, which you might not even know that your OB has a patient portal with all of your records. But as long as we have something to at least show it, okay, she's GBS negative, she's hepatitis B negative, because that whole workup can be very expensive in the hospital. So if you don't have the records, it can cost you quite a bit of money, especially because, like I mentioned, that hepatitis B immunoglobulin is expensive. So if we don't know your hepatitis B status and it's ordered for you, it can be a little pricey. So at least, if anything, this class saved you money. At least I hope so. And then I will be starting now. I don't think we have any more questions for now. And then we're going to go into labor and delivery, pain relief methods. As I was going down the list, one of the questions that I asked you all to answer was, what are you most excited to learn about? And by far, number one was pain relief. Number two is breastfeeding. So that's what I'm going to spend most of the time for our second half about.
So pain relief methods. So it's important to know non-pharmacological pain relief methods and the pharmacological pain relief methods as well. Even if you're going for a natural delivery, I still think you should still learn about both sides just to kind of help with your overall knowledge base, and also because I like to pick and choose sometimes. So like, let's say we have Lamaze. So many people, they'll focus, okay, I want to do pain relief methods. Let's do Lamaze. They'll have just Lamaze, you know, but there's so many other different pain relief methods that you can use that you can really use them to have a combination of different things. Take what you like about Lamaze, take what you like about hypnobirthing, take what you like about acupuncture, you know, take what you like about gentle delayed pushing, add it together, and then that's how you can make a really good experience for yourself. Now, let's say for whatever reason, your pain's under control, everything's going well, but then, you know, for whatever reason, you end up with a cesarean birth. Of course, we don't want that to happen. We don't want that to be on the, you know, we don't want that to be in the plan. But if it happens, are you prepared? Do you know what to expect? So that's why I like to go over both of them, just so you kind of know what to expect. So the first thing that you can always start out with when you're dealing with your pain relief methods is Lamaze or breathing. That's because, remember, I mentioned it a little bit about how when you're preeclamptic and your blood vessels are constricting and it decreases the blood flow to the placenta. Now, a similar thing occurs when you're contracting. So let's say you are in labor. So let's say you're in labor and your uterus is contracting. For a small amount of time, your baby's having a decreased amount of blood flow to the baby because you're having a decreased amount of placental blood flow. So that baby's oxygenation is going to decrease for a little bit. That's why sometimes you might even have an early deceleration where deceleration is when the baby's heart rate drops. What Lamaze does is it helps your breathing not only for your pain relief, but also to give you a little bit more oxygen, that you can have a nice base of oxygen to support your baby as you are contracting. So let's say you're having a contraction, but you're breathing through the contraction, you're increasing your oxygenation to yourself, therefore increasing the oxygenation to your baby. So that's what Lamaze is there for. It's for breathing, for pain, and for keeping the baby's oxygenation up. Now, I'm gonna give you an example exercise of each one. So for Lamaze, breathing, the easiest way is to have a focal point. Let's say you have a clock. Let's say you have your partner, you know, a spot on the wall. You have a focal point. And then what you're going to do is you're going to breathe in through your nose for 3 count. So you go 1, 2, 3, hold for a sec, and then out through your mouth for 3 count. 1, 2, 3. When you are having that breathing exercise, what some people do is that they will focus on a different part of their body with every exercise. So let's say you'll have, you know, the first repetition here, you're going to focus on your arm. You know, that is going into gate theory, which is another pain relief method. But that's basically saying that your body can only handle a certain amount of stimulations at once. So if you are giving your body the sensory input, like, hey, focus on your arm, it's not going to be focusing so much on your uterus. So that's what Lamaze is doing. It's saying, okay, I'm going to be breathing and I'm focusing on my arm. You know, do that for a few repetitions. Then you're going to focus on another body part. You're going to focus on your other arm. So then what that does is that helps you with your breathing, and it kind of helps to take the stimulation off of the uterus, off of your, you know, what you're focusing on, and focus it on a different body part, because that's a gate theory if you ever want to look at that. Now, the second one is acupuncture, which is not what it seems. Like, acupuncture is not only having those little pins in different points, but acupuncture is based on pressure points. So there's different pressure points. I'm not sure if you ever noticed this or not, but if you have a headache and you go like this, it actually can take away your headache because of the nerve endings that are here and the pressure that is put on that space. This is actually a good labor spot as well. So if you are in labor, this can help to progress your labor. Even doing a massage here and then even doing a massage here, that helps to move your contractions down. That helps to progress your labor as well. Another pressure point as well, one is right in the sacral area. if you press on that sacral bone, although this is not necessarily acupuncture as much as just putting pressure to relieve pressure, especially if you're getting back pain, if you put pressure on that sacral bone, it will help to kind of release the baby off of the pelvis there, so that you can hopefully move the baby down. Another pressure point is, here I can show you by standing up, is, I'm not sure if you guys can see, but right here in the gluteus area, right on the top, that is another pressure point as well that can help you with pain and can help help the contractions down as well. So you have the Lamaze, you have the breathing exercises, you have those pressure points, and we can talk about more pressure points. What's cool is all of my classes and consultations, the premium classes, come with the childbirth toolkit. So I'm not sure if you guys saw the childbirth toolkit to be as a selection if you were signing up for any of my classes, but the childbirth toolkit has like 7 to 8 exercises for each pain relief method. So it's actually really cool. We have the acupuncture pressure points. We have also water birth. The thing with water birth is that it allows you to move a little bit better and it keeps gravity off. So that's what some people like about water birth. But of course, that's more personal decision. Me personally, I don't think a water birth is for me. But if that's for you, that's the big benefit of it, is that it allows you to move more freely. And then if you are able to move more freely, that baby can move down the vaginal canal a little bit easier. Then we have focused meditation, also called hypnobirthing. So hypnobirthing does not necessarily mean that you're going to be out of it. Like at first, I kind of thought that's what it was. I'm like, hypnobirthing. Like when it first came out, I'm like, what in the world is this? But it's not like hypnosis, where like I always visualized in my head like someone with like a thing like this going back and forth, and you're like, I will deliver the baby. But that's not what it is. So it basically is focused meditations and repetitions as you are in labor, that are usually positive affirmations. So the childbirth toolkit also has positive affirmations that you can kind of repeat to yourself. Like, my body was made for this. In just a few hours, I will meet my baby. In a few minutes, I will meet my baby. Different positive affirmations that will help you to progress your labor. Gentle and delayed pushing. So this is another pain relief method for the pushing part of it. I see some people, they always focus on the labor part, but not necessarily the pushing. When you're pushing, make sure that you are not pushing with your vaginal area, but you can push more from your chest to your belly, but you don't want to push from the vaginal area, because that's how you're also going to tear. Now, one thing gentle delayed pushing does is that I noticed some people, they will wait until, like, let's say they'll be checked and they're 10. All right, you're ready to push, let's go. But they're not really ready to push because they don't even have the pressure yet. So what gentle delayed pushing does is it says, okay, you're at 10. Do you feel the pressure to push? No. Okay, let's wait a little bit until you feel the pressure to push. Sometimes it could take 30 minutes, sometimes an hour. Let's labor down a little bit. You make sure that you are at the point where you can deliver and that, you can push your baby out effectively. Now, that's one thing that I realized with my first baby, that I did not do that well. I had to push for like 2 hours on and off. It was not very, very good, because my baby, when I first started, was not really low like he should. Now, I noticed that with my second, that I can really feel the pressure when it was time to push. Even with an epidural, you can still feel pressure. You just won't necessarily feel pain. So keep that in mind, okay? Then we have the pharmacological pain relief, which I want you guys to know also. So nitrous oxide is not really used that much anymore, but that's laughing gas. Local anesthetic is sometimes used for laceration. So sometimes if the baby, let's say you're gonna have an episiotomy, sometimes they'll have a local anesthetic, or even sometimes if you're gonna tear naturally, they might have a local anesthetic to help with the tear or the incision if it's an episiotomy. That usually wears off pretty quickly. Within an hour, it's usually wearing off. IV pain medications are short-term pain medications that they can give through the IV. Now, that is not like an epidural. That's not spinal anesthetic. That is just an IV pain medication that takes the edge off. So that would be like Nubane. That will be something where it's kind of short-lived, but it takes the edge off. The only thing with IV pain medications is it makes you feel kind of out of it. So with my first baby, I was kind of afraid for an epidural. So everybody's, different, everyone has different goals. For me, with my first baby, I wanted a natural delivery. But then I ended up like, all right, let me try the IV. And then I ended up completely out of it. And I'm like, do you know what? Just give me the epidural already. So then I ended up with the epidural. With my second baby, I was like, the IV pain meds did absolutely nothing. So I was like, once I'm in true labor, just go ahead and give me the epidural. So that was my experience, and it worked a lot better for me, for my aspects. But of course, everybody's different. So if you want natural, focus on learning those different non-pharmacological pain relief methods and try a combination of those so that you can get something that works for you. Now, if you are wanting to do the pharmacological pain relief route, think in your head, do you want to go from least invasive to most invasive, or do you just want to start off with epidural, or start off with whatever have you? It's completely up to you, and you have the right as a patient and as a new mom to be able to make your own decisions. So IV pain medications, those are short term. They kind of make you a little loopy, but they do their term, they do their work. It's just sometimes if let's say you had new pain or you had something before you were delivering, if you had it within an hour of childbirth, sometimes it causes respiratory distress or depression in your baby. So just keep that in mind. If you do have your baby come out and they have some slight respiratory depression, the nurses will be handling the baby, but don't be too alarmed, because that's usually something that they can handle with like Narcan or something to reverse it. And then the baby usually transitions just fine after that. Epidural is a nerve block that they will do if you're having a vaginal delivery. Sometimes they have walking epidurals, but if you don't have a walking epidural, the biggest difference is you will not be able to walk, and you'll probably have a Foley catheter, which drains your urine and keeps your bladder empty. That usually wears off in about 1 to 3 hours, but everybody's different. Sometimes it takes a little bit longer, and that's okay. A spinal anesthetic is what you'll have if you have a C-section. The biggest difference is that the biggest difference with a C-section spinal anesthetic is that it lasts a little bit longer. So it will last usually about 6 to 8 hours, and then you'll want to get out of bed. General is something where they put you under. That's more like an emergency complication. If there was a problem with the baby and they needed to really get the baby out right away, they would probably do general, put it in the IV, put you under, and grab the baby out. Now, Chelsea wants to know, how do you prepare for an epidural if you are afraid of needles? So I am really afraid of needles. I'm going to be completely honest with you. I'm really afraid of needles. But when the contractions are happening, I didn't care. Like when the contractions were happening. So I have Bree also. I'm afraid of epidural, but want something to help pain. What is similar to an epidural, but not a spinal injection? So Bree, the biggest thing would be your IV pain medications. Every hospital has different medications that they would give you, but those would be IV pain medications and then your non-pharmacological pain relief. Now for Chelsea, who is afraid of needles, you don't need to look at the needle, try not to look at it, but think about how it will be helping your contractions. And then one big tip that I have is, if you want to make sure that they get it the first time, is you lean forward and kind of open your back. So you can even try that right now. Like if you lean forward and then you open your back a little bit, that will help so that they can get it. And try not to move when you first get it. Sometimes you might even feel some tingly in one side or the other side. You can talk to them, but try not to move too much. And then for those, because that was me with my first baby. I was afraid for an epidural, and then I just ended up in labor for a long time. I ended up in labor for 18 hours, not progressing until I had the epidural, just because the IV pain medications, they take the edge off, but they don't take the pain away. So IV pain medications would be great in combination with pain relief, the non-pharmacological Lamaze and the acupuncture. And if you're having the ball, for example, you can use the ball as well, and that can help as well. So we have a case study here. So Pain relief techniques. So can you guys tell me some of the pain relief techniques that we mentioned before? This is Nathan again, because I think he's cute. I think I had a lot of pictures of Nathan as I was making this PowerPoint. So I think he's really cute. He's like, sup guys. But let's say you were a new mom who wanted to progress through labor. And what are some, I'll focus on this. What are some non-pharmacological pain relief techniques? That can be an exercise, maybe that can be whatever might have you. Non-pharmacological pain relief technique to help new moms deal with their delivery. And what would you say? I will give you guys a minute to think of that. And some non-pharmacological pain relief techniques, just to kind of summarize what we talked about before. We have like the Lamaze technique, and I did mention the 3-count breathing in, 3-count breathing out, having a focal point. You can focus on a different part of the body. And by the way, I do sometimes have focused breathing for my C-section patients after they deliver. So if you're going in for a cesarean birth, focused breathing and the pain relief techniques, even the non-pharmacological pain relief techniques, work very well for operative pain. So that's another thing to think of. Also, because after you have your baby, you're going to have some contractions as well. So whether you have a vaginal or cesarean delivery, sometimes that focused breathing, affirmations, all of these can work very well to help you with the pain after you deliver. So good. We have Nicole saying acupuncture, focused on breathing, delayed pushing, perfect. And then Estella mentioned the breathing as well. So you guys love the breathing just as much as I do. And then Bree talked about positive affirmations. On the childbirth toolkit, I also have positive affirmations as well. So one thing that I've realized a lot of childbirth classes lack is postpartum care. And like I mentioned before, I'm a postpartum nurse. So that is my specialty, and that is something I'm really passionate about. So make sure you know how to take care of yourself after delivery. So some expectations, what to expect after you have your baby. A lot of people know what to expect as they're in labor, but then when it comes to, all right, what to expect after I have the baby, they have no clue. So after you have your baby, this is for C-section and for vaginal delivery. You might have some shaking, you might have some contractions, especially the more babies you have, the more contractions that you have. So I noticed with my first, I didn't really need Motrin that much, but with my second, my contractions were much worse. So with every baby you have, your contractions are a little worse. And then also as you're breastfeeding, your contractions happen as well, just because breastfeeding releases oxytocin, which is the milk letdown hormone. And that also travels to the uterus to keep it nice and contracted and firm. So you're having the oxytocin release from the breastfeeding, and you're having the oxytocin release to the uterus. So it's going to have some contractions. You have mood swings, especially because your placenta was like a hormone factory. Comes out, your body's like, whoa, what just happened here? So we have some mood swings, period-like bleeding, also called lochia. So for lochia, if your period-like bleeding is, let's say you go to the bathroom, an hour later, you saturate the whole pad, that is heavy bleeding. So you would want to call your doctor about that. You might have little blood clots come out, but if you're having blood clots the size of your fist or bigger, those are definitely signs to call your doctor. So heavy bleeding is if you saturate a pad in an hour, big blood clots coming out, size of your fist or bigger, definitely let your doctor know. For a C-section, you're still going to be having vaginal bleeding, by the way. Some people find themselves surprised when they have a C-section and they didn't think that they would be having bleeding after, but you're still going to be bleeding after. You're going to have the contractions just like a vaginal delivery, but you're also going to have the incision pain, which feels like burning. Sometimes it'll burn more on one side than the other side. Usually the first 24 hours, your spinal is still in your system, so you don't feel as much. But then after that, sometimes it can be a little painful for you. So keep that in mind. Complications, hemorrhage. So that's just like we mentioned before, if you get that heavy bleeding, big blood clots. high blood pressure, which we mentioned before as well. So especially sometimes I'll have someone 160s over 110. So I'm like, oh man, we might have to have some IV blood pressure medications. If it gets very, very high, they might put you on something called magnesium. And if you're on magnesium, they'll be checking your reflexes a lot, and you will have a little bit of a higher acuity. So you'll probably have to stay in labor and delivery. Magnesium does get you very, very drowsy, by the way. Sepsis. So sepsis can happen for both vaginal and C-sections. That's infection. Vaginal delivery sepsis can be from the placenta, it can be from the delivery, it can be a whole bunch of different reasons. And it's nothing necessarily that you did anything wrong. So it's not like I've had people say, oh, if I clean myself better, can I have avoided sepsis? There's nothing really to say that if you were doing something different that it would cause any change, but what you can do after to hopefully prevent infection after of like smaller infections like UTIs and yeast infections is when you have your baby, make sure you're having good vaginal hygiene, such as you're using your peri bottle. You can still use that plastic bottle and clean the vaginal area after every time you go to the bathroom. And that also helps if you're peeing after having a vaginal delivery with a tear. If you use that plastic bottle, it'll help you with the pain in the vaginal area. So that's a little tip for you as well. So we have infection, depression as well. So depression can be a complication if you feel like it is coming in the way of daily life. If you feel like it is more than just the baby blues, talk to your doctor about it, keep your support system close, and that can hopefully help with the depression. So here is a common situation. We have a tear. So I want you guys to tell me, what would you recommend to somebody who had a 4th degree tear? Now, this is a tear that's from the vaginal area all the way to the rectum. So it's a very bad tear. So this is one of the complications after delivery that a lot of people want to know about. They want to know about, how do I help myself after I tear? So after a vaginal tear or after a episiotomy, what can I do to take away the pain or to help me recover quicker after tearing vaginally? So some things that they might be doing to prevent your vaginal tearing, they might be doing some massage, they might be doing some perineal massage before you have your baby. They might also try to delay your pushing. So for example, even though you're at 10, but the baby's still really high up, floating in the abdomen somewhere, they might want to wait a little bit. So those hopefully can decrease your risk of tearing by doing the perineal massage. They might even have the oils. They'll try to wait until you're ready to push before pushing. And then what would be some recommendations for a mom who had a tear? So I'll give you a few of mine, just a few of my favorites. Number 1, Tux is very, very good. Tux and Dermaplast sprays. Tux is for hemorrhoids. You can have them for hemorrhoids, but you can also have them in the vaginal area. They really help. It's kind of like a medicated pad that you can put in the vaginal area or even on the pad itself, and that can help with vaginal pain. Also, Dermaplast spray, they sell that at Walmart. They sell it at Amazon. Me personally, I like everything on Amazon. But so Amazon, they have Dermaplast spray, they have Tux pads. You can even get something called a sitz bath. That's SITZ bath. So that's kind of like a spa bath that you can sit your bottom in. You can even have some Dermaplast in there. They even have Tux as a like witch hazel as a like in a bottle that you can even put inside the water in there, and that can help with your vaginal pain as well. So we have the SIDS bath, we have the Dermaplast spray, we have the Tux pad. Now another one that a lot of people don't realize is also you can have breastfeeding positions that take pressure off of your vaginal area. So one that I normally recommend if I have someone, for example, with a very painful perineal or vaginal tear, is I would recommend my patients to be sitting in a laid like kind of a sideline position. Sometimes sideline positions really help to decrease the pain that you have. So the side lying position, it helps because it keeps the pain off of that bottom area. So it's great. And then Bree said witch hazel on the pads, ice packs, numbing spray. All of those are wonderful, wonderful ideas. Thank you, Bree. You are completely right. I love those. Some people also get those donuts too, which is like a donut pillow. Those work really, really well as well. Now, we talked about labor, we talked about childbirth, we talked about postpartum care. Now, everybody's favorite part is newborns and what to expect when their baby finally arrives. Now, I know that you guys are so, so excited to meet your babies. Then especially we have all these new moms, and sometimes it can be overwhelming at times to think about all the different things that that go along with having a new baby. But remember that you can always email me, mommydidyouknow@gmail.com. You can also look at the links for consultations and keep my information. Because even if, like, let's say we don't go for consultation right now, I have had people that kept my information and then ended up having visits with me after their baby was born. Because if you have any questions, I'll be more than happy to help out. So normal newborn behavior. So normal behavior. So after your baby is born, you're going to notice that their baby is going to have this waxy, cheesy kind of looking substance over the body called vernix. Now that's actually good because that helps to be a natural insulator for the body and keeps and locks in temperature, moisture, keeps the sugar regulated, and it even helps with breastfeeding. So that's where, if you ever heard about the delayed bathing, that's usually because of the vernix that's on the skin. The vernix on the skin naturally absorbs into the baby's body. So we say, you don't necessarily need to do the bath right now. The baby is not rolling around in mud or anything like that. So at least you can, it can help you with that. Then we also have behavior changes. So normally, just so you guys have a quick rundown of what to expect as your baby is born. So when your baby is born, they normally have 1 to 4 hours of an alert phase. That's including that golden hour, which should have some skin to skin time and should also have some some breastfeeding also. If you're planning on breastfeeding, usually that's the best time. Now they used to say 1 hour. However, I normally recommend, especially if I'm catching the babies and I'm in labor and delivery, to not only breastfeed and do skin to skin for the first hour, but for that entire 4 hours, usually while babies are in that alert phase, keep the baby skin to skin with you and feed the baby on and off, feed the baby on and off. There's even some research shows that it actually increases your likelihood of having success with breastfeeding just by not only having that 1 hour of that golden hour, but by increasing that time as much as possible. So if you're thinking about this, even as a nurse, let's say I'm a transition nurse and I'm saying, okay, I'm transitioning babies today. How long am I transitioning my babies for? 3 to 4 hours. So why are we only doing the golden hour for 1 hour if they are transitioning for hours? And actually, in reality, babies are taking 24 to 48 hours to transition after they're born. So why are we only doing skin to skin for 1 hour? So I'm a huge proponent of skin to skin. In fact, most of the times, if you are my patient, I take the clothes off of the baby and I put the baby skin to skin with you immediately after coming into the room, just because it has so many amazing benefits for mom and amazing benefits for baby as well. So if you think about it, babies, they don't have a lot of brown fat in their body. And in order, I'm not sure if you noticed this, newborns, they don't, and this is cool, this is like extra for you guys, but I'm not sure if you noticed this, but newborns don't shiver like adults. When newborns are cold, they metabolize their glucose, they metabolize their sugar. So what's gonna happen if you have a baby who's cold? You're going to be metabolizing your glucose, you're going to be metabolizing your sugar, and the baby's not going to have the energy to do all of that other, amazing things that they need to do. So by being skin to skin with the baby, you're taking those demands off of the baby and you're handling the temperature for him or her so that they can focus on the important stuff, such as breathing and eating. So that's why I'm like, as long as you can, do skin to skin because it really helps. It helps to maintain the temperature, the sugars, even moms, it helps to maintain your blood pressure if you have preeclampsia. you have high blood pressure, it even regulates your blood pressure, and it even decreases your risk of postpartum hemorrhage by putting the baby on you, because it starts to stimulate that oxytocin release, which helps to keep that uterus nice and firm. So that was my little tidbit for you guys on that. Then we have after 4 hours, usually they'll hit about 12 to 24 hours of hibernation, where you gotta wake them up to feed. So normally I'll say feed your baby every 2 to 3 hours. If at the 2 hour mark, the baby's still very kind of sleepy, doesn't really show feeding cues, then you can wait until the 3rd hour mark. But after that, you wanna wake the baby up, change the diaper, tickle the feet. Babies hate it when you tickle their feet. Tickle their nose, their head, put the baby skin to skin with you, and then you can feed the baby and wake the baby up from there. Another thing that I see that is normal, but a lot of moms, they're a little nervous about, is newborn rashes. So if you think about it, babies were swimming around in the uterus in a fluid environment. They come out and they're, filled with clothes. They have clothes covering them. They have people touching them and kissing them. And it's just a different environment. Coming from fluid to air is going to obviously cause some irritation of the skin. So you're going to have some newborn rash. Generalized rash, usually not that big of a deal. However, if it starts having a lot of something called petechiae or petechiae, they might end up having H&H, which is a hemoglobin hematocrit. Just make sure the baby's not anemic. That's if the pediatrician will see if it's going from that rash to that kind of overall. So Nicole wants to know about delayed cord clamping. Is this normal practice now, or do you normally need to request it? In my hospital, it is normal practice. It is part of the policy. However, you can always confirm with your doctor. Research shows that delayed cord clamping helps the baby to transition, and it even helps to get that, last bit of oxygen so that the biggest reason for that, if you think about it, in the uterus, the baby's circulatory system is different than outside of the uterus. So within the uterus, the baby actually is not using the lungs. It's being oxygenated by the placenta. So the baby has a hole in between the 2 atrium of the foramen ovale. Now, normally when the baby's born, the baby's first is gonna end up having pressure and closing that foramen ovale. What they want to do is delay that cord clamping so that they can give that baby time to have that first close that foramen ovale and all the other plumbing that needs to change as well. So it helps with the circulation for the baby. That is what the research is showing. Normally it's in the policy. However, you can always confirm with your doctor just to make sure. Noisy breathing. So rapid breathing is anything over 60 breaths per minute. So normally newborn babies, I'll get calls from moms sometimes like, oh, my baby's breathing fast. And I look and it's like 35. Babies breathe faster than adults, but no more than 60. If it's over 60, that's tachypnea. And you're very welcome, Nicole. Tachypnea is fast breathing. Normal newborn is also soft spots. So kind of a fun tidbit is that when the baby's leaving the vaginal canal, the skull is made not only of bone, but cartilage. That allows the baby to come down the vaginal canal and mold towards the vaginal canal as the baby's coming down. So the baby has 2 soft spots, anterior and posterior. Anterior takes about, and Adrita wanted to know about delayed cord clamping and cord blood donation. Usually that does not make a difference. If you wanted cord blood donation, usually they'll give you a box and then you'll give that to the nurse. And then as they take away everything, they'll put it in the box and then the site will come and pick up the box as you're in the hospital. But that was a good question. So we have anterior and posterior. Anterior soft spot or the anterior fontanelle usually closes about 1.5 to 2 years. But of course, every baby's different. Then the posterior one usually closes about 3 to 6 months. Now, the big thing with that is that if you're planning on breastfeeding, another thing is that your fontanelles is a great indicator of hydration. So if you have a newborn and their fontanelles are sunken in, that can be a sign of dehydration for your baby. So you'll definitely want to look into that. Now, red flags. So these are things that you would want to look into if your baby starts doing any of these. Number one's retractions. That's when they start using their accessory muscles to breathe. You might notice if you have a premature baby, sometimes they'll have retractions, but they definitely should not if they're a full-term baby. And it should not be all the time either. Even if you have a premature baby, they might have retractions as they're digesting their food. Sometimes I'll notice that in the NICU, but they should not have long-term retractions. Lethargy. If the baby's lethargic, not waking up for feeds, that would be a definite red flag. Sometimes that can be for infection, but a little known fact is actually hyperbilirubinemia or jaundice can also cause lethargy on a newborn. Fever or even low temperature can be signs of a red flag. Tachypnea, which is what we talked about before, and like I talked about, sunken fontanelles. So this is really important. I've talked about GBS before, but in this case study, so let's see how much you guys were paying attention. We have a mom who was GBS positive. Let's say she did not have treatment. What were the signs of infection that she needs to look out for? So let's say you guys can type up now, what would be signs of a GBS infection in a newborn baby? Or even what would be signs of infection in a newborn baby? Now, if you are pregnant, especially if it's your first time mom, you wanna pay close attention to this part. What are signs of infection for your newborn? So remember, we did mention that there are plenty of things that are normal for newborns, such as, they'll have a heart, they'll have the breathing rate about 30 to 60 times per minute. Another thing I didn't mention before, but newborns sometimes are very congested as well, especially as they're coming down the birth canal. It causes a lot of inflammation. If the baby is spitty, which sometimes happens, especially with cesarean births, you can try to use a bulb syringe, but always mouth first. So if your baby is spitting, mouth first, then the nose. Because if you do the nose first, they'll choke on whatever in the mouth. So that's a big thing here. But so I want you guys to tell me some signs of a newborn infection. So some signs that a baby might have a GBS infection. Now, if you are GBS positive and you don't end up with adequate treatment, your baby will probably have a sepsis workup. They will not automatically be transmitted to the NICU, by the way. So just because you're GBS positive, does not mean that your baby will go to the NICU unless they start seeing signs of infection. That's why it's important to know the signs of infection yourself, just so that you can catch it, just in case the nurses don't catch it. Because sometimes you're with the baby more than we are. We might be there for like 10 minutes, 15 minutes, but sometimes something might come up. And it would be good to be aware of different signs of infection for your baby. Or even if it's not even GBS, it could be like your water broke for over 18 hours. That's another sign of another risk for infection as well. But sometimes what I'll see is, let's say, baby all of a sudden starts having signs of tachypnea. Baby starts having signs of fast breathing. I'm like, all right, something's going on there. That can be a sign of infection. Sometimes if a baby is very lethargic, that's another sign of infection, that all of a sudden they just not getting up for feeds, not waking up. They can have a fever. That's another sign of infection. Even sometimes low temperature, because they're working really hard to fight off the temperature and they're using all of that glucose. And remember, the glucose is what they're using to keep warm because they're metabolizing their glucose. So all of those are different signs of infection that you should definitely look out for as a new mom for your baby. So you're going to be having the tachypnea. You might even be having the retractions, the respiratory distress. Also sometimes nasal flaring when the nose starts going like that and start kind of lifting up from there. And then feeding your baby. So there's different ways to feed your baby. I know that a lot of people are breastfeeding. So I have a whole section on breastfeeding as well, like a whole breastfeeding YouTube playlist that you guys, feel free to look over that as much as you want. But so feeding breast milk is amazing for your baby. Your breast milk is like an antibiotic for your baby. It has exactly what they need for their specific moment in time. which is amazing because they even showed that babies that are premature have a different milk composition than moms of babies who are full term. And formula does not necessarily do that. Now, of course, if you want to formula feed, that's your decision. But if you wanted to breastfeed, one of the best things you can do is start breastfeeding as early as possible and as efficiently as possible. I would say about 75% of breastfeeding, and I'm not kidding you, is the latch-in position. If you're latching your baby effectively, your baby's going to be transferring milk. If your baby's transferring milk, then your breasts are emptied. If your breasts are emptied, you're going to produce more, and then you're going to end up with a good milk supply. Therefore, it's a whole good cycle. If your baby is not latched on correctly, it's like sucking on a straw with a hole in it, where you're trying to suck on something, you're trying to get the fluid out, but for whatever reason, it's not coming out. So if that happens, you definitely want to contact me. I can look at your latch. Some of my clients will even send me a picture, be like, what do you think of this latch? Now for breast pumps, because I know that some people probably are planning on pumping. If you are planning on pumping, keep in mind that colostrum does not come out really well on a pump. Usually you'll want to wait a few days before you start pumping, but try to have the baby to do as much breast stimulation as you can. I personally use the Medela, and I like the Medela InStyle, the double electric InStyle, and then I use the Medela hand pump as well. But I have a lot of clients that use the Spectra, and they really have been liking that one as well. I personally do not like the hands-free one unless you're at work and it's the only way that you can kind of get things done, just because I'm a big proponent of active pumping and compression as you're pumping. So when your baby's on your breast, your baby is not just stretching the nipple, right? Your baby's compressing the breast. So that releases the oxytocin. The oxytocin is released by the nipple stretching and the breast compression. Now, if you have a pump and you're just stretching the nipple, but you're not compressing the breast, you're only getting half of the stimulation as you can. And then that's how you're getting those moms that their supply is going down from pumping. So that's why when you have that pump, you want to compress. You want to compress the breast. You want to have active pumping sessions where you're compressing with your pumping session. And that's the key with pumping. Like, honestly, that's a huge key with pumping, is to compress with the sessions. With breastfeeding, make sure that your baby's belly to belly. I don't know how many times I come into my patients' rooms and they're like, the baby's not latched on right. And the baby's like belly's up into the sky. Baby should be belly to belly, tummy to tummy, okay? Skin to skin if possible is great. Make sure the baby's diaper is dry. Sometimes if the baby's diaper is dry, it doesn't really work as well. So make sure the diaper is dry so that they're not gnawing on the breast, but they're actually eating. Tummy to tummy, express some colostrum, put it on their nose, because babies, they work a lot with smell. Then when they open wide, you go, open nice, about 140 degrees should be the angle of the mouth. And then make sure that the baby's not just on the nipple. So if you have the nipple here, make sure they're not just on the nipple, but they're on the areola as well. So sometimes they'll come in and the moms say that they have a lot of pain or soreness. But if you think about it, if you are on the nipple, that's how you're getting soreness. But if you're getting areola, you're not touching the nipple at all. You're just touching the areola. And that's where all of your milk receptors are. They're not in the nipples. And then Estella wants to know, how do you know if you're getting milk from the breast? So number one is you check the diapers. So we want as many diapers as there are days of life. So for the first week, peas, we want 1 pea the first day, 2 peas the second day, 3 peas, so on and so forth, up until 6 days of life. So pretty easy to remember from there. If we get more, even the better, but at least per 24-hour period, we would want to have at least 1 pea the first day, 2 peas the second, 3 peas the third, up until the 6th day. For poops, it's up until the 3rd day. So we would want 1 poop the first day, 2 poops the second day, 3 poops the 3rd day. After that, it's about 2 to 3 poops per day for the first week. So I know that seems overwhelming because there's a lot of numbers, but it just goes by the day of life. That's all. So Estella, to also answer your question, so we have the diaper changes is number 1. Number 2 is weight. Normally babies will lose up to 7 to 10% of their weight as they are, going through that first week of life. Then they start to regain it. If they lose too much, that can definitely be a sign of dehydration. We also have the bilirubin test, which is normally done around 24 hours of life. Sometimes a little different depending on the hospital. Usually babies who are dehydrated, sometimes their bilirubin levels will be higher. So that's another way that we can tell. Also sugars. If I have a baby who's not feeding that well, sometimes I'll do a sugar at the 24-hour mark to just kind of see where the baby is. If the sugar is low, then we can make arrangements from there. Also, how I was mentioning the fontanelles, how the fontanelles are sunken when they're dehydrated. I hope that answers your question. I get that question all day, every day. So I have like 10 different things I tell my parents, but I hope that helped to answer your question about hydration for a breastfeeding baby, because there really is no gauge to see how much. And keep in mind too that pumping is not an indicator of how much your supply is. So you can pump and get out 1 ounce, and then you can feed your baby and they can take out 4 ounces. So it's not necessarily related to your supply. So just keep that in mind. Now, you guys learned a lot, didn't you, today? So for this last case study, we're going to talk about, let's see, a feeding choice and what would you recommend to this mom who wants to, let's see, what about this mom who wants to breastfeed? What recommendations would you give a mom who wants to breastfeed her baby? Now, this is our last case study. Then we're going to have a giveaway for a very special package. So what would you guys recommend to a mom who wants to breastfeed her baby? So I'll give you guys a few minutes to think. You guys are learning a lot today, right? After this, I think I'm going to have lunch or dinner, actually. But anyway, so what advice would you give a mom who wants to breastfeed? So breastfeeding education, I think, is so important before you guys have your baby. So like I mentioned, there's certain things that you can do before you have your baby, which I go over in my prenatal classes too. When we do live prenatal classes, I go over that as well when we do private ones, different steps specifically that you can take to help to make sure. Nicole said, meet with a lactation consultant to make sure the latch is correct, especially for having pain. So that is so correct, Nicole. I don't know how many times I go into the patient's rooms because I'm lactation sometimes on the floor too. I'm everywhere. If my hospital was like, you guys better not, the hospital knows that I have Mommy Did You Know, my private practice. They're like, just make sure that you don't leave us, okay? I'm like, I know, I always want to stay there to at least keep my skills up with everything. But I absolutely love being a lactation counselor. I love being a lactation support. It really makes such a big difference for my family's lives. If you're in Boynton Beach area, I do, or even Broward, Palm Beach for South Florida, I do home visits as well. So yes, make sure a baby can latch properly. That is a huge thing. Another thing is be positive. So many times I come into mom's rooms and then they're holding the baby and they're just like, I don't have any milk. That's just going to set yourself up for discouragement. So you want to be positive, make sure the baby can latch, but be positive, be positive, well supported, positive thoughts. So we had so much fun this past 2 hours. And I know that I mentioned a prenatal package to you guys, but I just want to mention it to you just a little bit more in detail, if that's okay. And I know that everybody has different goals and what interests somebody, one person might not interest another person, and everybody is individualized. And that is why I offer my Childbirth Masterclass prenatal package. That is not just about, everything, but I go over specifically what you guys need as a family. That's why I do a private Zoom in addition to my regular coaching. So feature 1, which is awesome, is I do prenatal coaching. So this is one package that I have that I always offer to my clients as well. So starting prenatally can help you so much. It can save you money, save you time, save you tears. So my prenatal coaching package is 2 hours of private prenatal classes. So imagine how much we learned in these 2 hours. Imagine if I were to have you just me and you. So I go over even more in depth all of this that we talked about. In addition, I'll talk about how to overcome your specific goals for your family. You can do one big 2-hour class. You can do 2 1-hour sessions, or even 4 half-an-hour sessions. You schedule it whenever you want. And then I even have an online portal where you can access all your notes, manage your appointments, and I have handouts that you have digital access to. And then one really important feature that not a lot of other lactation consultants have, or other childbirth classes, is that you also have unlimited support for the duration of your pregnancy while you're in my program. So sometimes I'll have somebody that's pregnant and they go to the doctor's office and they tell them something, but they don't understand it that well. I can at least help you to understand. Or sometimes you're in labor and you're like, oh, how do I deal with this back pain over here? We can have a little conversation and I can support you during your prenatal journey, whatever it might have. And then you receive downloads of all the Zoom visits. So I send it through a secure portal. So like, let's say we have your prenatal class when you're 30 weeks, and then you're going in for your delivery tomorrow and you want to brush up on everything we talked about. You will have access to all of your Zoom visits so you can look at it again. And then number 2 is all premium courses at Mommy Did You Know? So I have like 8 hours of videos. I have a breastfeeding class. I have a childbirth prep class. The breastfeeding class, I'm telling you, is so in depth. Like, you can probably go in for a lactation certification exam and pass it. Like, that is how in depth it is. Each of those are 2 weeks long. I'm not kidding, 2 weeks long. So you have self-paced, but you have a guided lessons every single day, which is fantastic. You have baby care information. It has a lot of content, research-based articles, and then it even has tests and reviews with explanations, so you can really understand what it's talking about. So you're getting the prenatal live classes and you're getting the prenatal online classes. Then you're getting digital downloads, such as so these are books. I literally wrote the book on breastfeeding because I love teaching so much. And I wrote the book on the prenatal care. So you get prenatal crash course, the breastfeeding and pumping. You get a safe baby ebook because I'm a huge proponent of SIDS. I want to make sure that you understand sudden infant death syndrome and how to prevent it for your baby. And then a nice bonus that you're also going to get in this package is the Childbirth Mastery Toolkit, which I mentioned a few times during this class in case you didn't hear. But we have like hypnobirthing affirmations, we have pressure points. In addition, I have breastfeeding cheat sheets. I even have developmental guidelines, Lamaze breathing guides, infant CPR. I go over infant massage. Infant massage is fantastic. You can start infant massage even as soon as the first day of life. We even go over prenatal and postpartum exercises for let's say after you have your baby, you can go over how to prevent that hip pain, because sometimes even if you're when the baby comes out, sometimes it separates some of the bones. So you have exercises to specifically help to bring everything back together, prenatal exercises as well to help to progress your labor along. And then as an extra bonus, I'm going to add a postpartum consultation also. So that will be, so you'll have your 2 hours of prenatal live visits. You'll have your month-long premium prenatal classes. You'll have your ebooks and you'll have the toolkit. In addition to that, you'll be able to schedule a 1-hour consultation after the baby is born. I'll assess the feeding. I'll set you up with your breast pump. I'll answer your questions. We can even go over bottle feeding if that's what you're doing. We can go over sleep training. We can go over infant massage, whatever you want to know. So it's a great package, right? So, all of this is easily worth over $600. I mean, easily. I would have paid somebody that much easily, just because it has your prenatal coaching, you have support for your whole pregnancy, you have the course access that you can have. Oh, and all Zoom visits, you can include family in too. So like, let's say we're having a prenatal class about baby care. You can invite your family members so that they can find out how to put the baby to sleep. They can find out how to prepare your milk. They can find out how to swaddle the baby, because I go over all of that great stuff. Like, honestly, when I was pregnant, I wish that this package was available. And what's great is I have this special. So if you see under sign up for today's special by clicking here, that is going to be the coaching package, and I'm offering a great discount where it's only $150. So if you look at any other competitive prenatal course like this or any other comprehensive prenatal course like this, it's easily $600 to $700. I've even been seeing like some doulas are like $1,200. And what's great is that it saves you so much money, honestly, because price of formula, price of going to the doctor, because if you can breastfeed your baby appropriately, also you have less doctor visits. You can save yourself even exams and tests that you don't need to be done. So I cannot express the importance of prenatal education like this. So that is you'll see it on the description. Sign up for today's special by clicking here. I will also, if you signed up for this, I can also email you the link as well, but it's really helpful. You can also, if computers are not your thing, you can email me at mommydidyouknow@gmail.com and ask to sign up for the coaching package that I mentioned today. Now, that's great. You're getting the prenatal coaching, you're getting all of that great stuff. You're getting the postpartum coaching, you're getting the downloads, and then you'll be able to partner with me for your pregnancy. So at least I can give you all of this information that I have and just transplant it into your mind. So, which is great. And then there's some reviews. You can look, if you Google Mommy Did You Know, you'll see a whole host of reviews so that you can make sure that this is the right decision for you. And you also have, you can have a refund too within 30 days. So if you sign up and you're like, oh man, actually this is not for me, it's too much, or, anything like that, you can always ask me for a refund, no questions asked. So I'll give it to you. Okay. I promise. I hope that you guys learned a lot. So one thing I'm going to do is I'm going to have a giveaway. And then you're going to have access to all of my online courses for free. So that's my childbirth class, and you're going to have my breastfeeding class. Now, the breastfeeding class, I'm so proud of. I know you're going to love it. It's really a must-have class if you have not signed up for it yet. And it's on mommydidyouknow.com, just in case you haven't seen it. You'll see under education, it'll have all of my available consultations and classes and things like that. But the breastfeeding one, if you're planning on breastfeeding, it is fantastic. I'm not kidding you when I say that you can take that class and sign up for a lactation certification exam and pass. It is very good, very in-depth, goes over a lot of different positions. It's wonderful. So one lucky mom will receive my online childbirth masterclass and the breastfeeding class for free. So that has contents and videos, articles, and quizzes. I figured I would thank you guys for sitting here and listening to me for 2 hours. And I hope that you guys learned a lot. So the way that you can be entered is write a comment with your favorite thing that you learned and a number. So let's say your favorite thing that you learned was breathing exercises. Say, my favorite thing to learn was breathing exercises, and then write a number 1 through 10. Okay. So we'll start now, and then we'll be open for 2 minutes. Then I will announce the winner. So you guys can say what your favorite part about this course was, and then a number from 1 through 10. So I'm going to think of a number 1 through 10, and then whoever gets that number will win the course. And that's an amazing course too. And I hope that we're able to connect, and you guys can always sign up on the description, sign up for today's special by clicking here. That will, I wish that there was something available for like that for me while I was pregnant. Just because it's nice to be able to partner with somebody as you're pregnant, or even after you have a baby, because, you get a lot of questions. Yes, comment in the chat here. So you'll comment in the chat box your favorite aspect of this course that you learned, or even something cool that you learned, and then a number. Non-pharmacological pain relief was Nicole's favorite part of the course. I like that part too, especially because with my first, I found that I didn't really know that much about pain relief. So Adrita said that her favorite thing was learning about normal newborn behaviors. Yeah, I find that a lot of moms, when I come with the new moms, that sometimes they are very shocked to see that babies change so much within the first day, you know. Another thing too is after that 12 to 24 hours of hibernation, they're also very active after that. They're normally like 4 hours of active, 12 to 24 hours of hibernation. Then they just cluster feed a lot. So keep that in mind too. Ashell said, I learned how to determine real labor and Braxton Hicks. Now that's really important too, because sometimes just knowing the difference, all right, you know, these are strong in intensity and they're regular. That's how you can tell that it's real labor. Samantha said, I thought it was helpful to learn about the option of gait theory with breathing. Yeah, I think that's really cool to be able to combine different methods. I find that a lot of people end up learning a lot about one method when you can combine different methods and find what works for you to, you know, have the best. Gina said the golden hour is actually 4 hours. Yeah, because if you think about it, babies are transitioning for so long. You know, it's not just 1 hour of transition. You want to try to do skin to skin and breastfeed that baby as long as you can. Estella said, learning about taking care of myself postpartum. Tux pads, the dermaplast spray, not germ spray, dermaplast, but you were close. Sitz bath, also the breastfeeding, knowing if they're receiving milk. Yeah, because there's a lot of signs we can look out for. Then Bree said latching and breastfeeding. That's perfect. And I hope that you guys, I get to see you all from my coaching class as well. So we have 2 winners, actually. We have Nicole and Gina. Congratulations, you won the free classes, the free childbirth masterclass online. So that's going to be my childbirth prep class and the breastfeeding class that you guys have won. Congratulations. So the way that you're going to be able to claim it is simply by sending me an email and saying that you are the giveaway winner. Okay. And I remember your names. Yes, Nicole and Gina. So you guys are the giveaway winners. Just email me, mommydidyouknow@gmail.com. Say, oh, I won the giveaway. I'm so excited. You know, whatever you want. I hope that all of you guys learned from this class. I hope that you can stay connected. Remember that you can still subscribe. You can like this video as well. And, you know, I am here to support you in any way that I can. So you can always sign up for the classes. If you go to mommydidyouknow.com, you'll see under the education tab, you'll see all the classes I have, consultations, and then you'll also see today's special that's right on the description there. That is for the coaching package that has the online courses in addition to the toolkit and the coaching live. So it's fantastic. Nowhere else you're going to be able to find online classes and 3 sessions with a lactation nurse. So it's fantastic. So I wish you guys all the best. I wish you a happy childbirth experience. You can always connect with me also if you have a childbirth experience, you want to share something, you can always connect with me on Facebook, Instagram, mommydidyouknow.com, okay? I'm so happy that you guys won and it was a pleasure. So I'm going to close out this video now, but if you guys have any more questions, I'm so happy that I was able to work with you guys today, and it is, it is such a pleasure. I love teaching, you know, so at least I found something that I'm passionate about and I like, and it really makes a genuine difference, and I know that at least we can get people started, you know, on the right foot. So have a great rest of the day, and I wish you guys all the best, okay?